Hello student, today we will see one more gynecological disorder, that is ovarian cyst. So what is a cyst? Cyst means it is a non-cancerous growth. Either it will be in a very soft form or it is in a very solid form. Okay. A solid or a fluid filled sac or a pocket within or on the surface of the ovary. Ovarian cyst means it develop over the ovary. Either it is a stone like solid or a fluid filled sac it will be. Then it will be a very like a soft it will be. See, normal the female reproductive organ. So normal anatomy of the ovary is here. Ovary is 2 in number, left as well as the right side. See, this is the normal anatomy. This is the entire female reproductive organs. See, here you can see in this picture how the cyst is over the ovary. The cyst is developed very big in size. Okay, there are many types are there, but few types very important. See, generally we will tell as a ovarian cyst only, but as a nursing student we should know, okay, this name is given according to how they form. So there are few types. They are, one is a dermoid cyst, endometrioma cyst, cyst adenomas. Functional cyst are two types. They are follicle cyst and a corpus luteum cyst. These two are important. Okay, so what is follicle cyst? See, when girls start to get a menstrual cycle every month, an egg grows inside the sac. That sac is called as a follicle. So this follicle is situated inside the ovary. So in most cases, this follicle break and release an egg. When that is a ovulation period we will call it. After 14 days after the menstruation cycle. So this follicle will break and egg will release. But if this follicle does not break open, the fluid, usually what it does, the follicle is called as it is a small sac, a secretory cavity. It itself will produce a small amount of fluid. So when it does not break, what happens? The fluid inside the follicle can form a big size of cyst, kind of a growth on the ovary. See that you can see in a picture here. Follicle cyst. Okay, the second one is a corpus luteum cyst. See, follicle sacs typically dissolve after releasing an egg. That is a 14 days after the beginning of menstruation cycle. That is, I said, ovulation period. The follicle will break and egg will release. So after that, it will dissolve and go this follicles. But if this follicles sac does not dissolve and the opening of the follicle seals, it remains like that only, what happened? Already it produces, I said, small amount of fluid. So additional fluid can develop inside the sac, and this accumulation of fluid causes a corpus luteum cyst. So usually what is corpus luteum? It is a mass, kind of a mass of cell that forms in ovary, and it is a temporary organ, okay, that appear every menstruation cycle. So then when fertilization will not take place, it will disappear, okay. But in this case, the extra fluid over that will form as a corpus luteum cyst. See, you can see in a picture various type of cyst, okay. See, the corpus luteum cyst is here, follicular cyst is here. The next one is a dermoid cyst. When we will call it as a dermoid cyst, as I said, the name is given how they form. See here, this is the one, dermoid cyst. You can see this cyst, how it is, like thorn and thistle like structures are here. The sac-like growth on the ovaries that can contain hair, fat and other tissues. You can see here. Okay, the next one is a cyst adenomas. It is a non-cancerous growth that can develop on the outer surface of the ovaries. See here. Some grow inside the ovary, some grow outside of the ovary, above the ovary. See here. See, endometriomas. What is endometriomas? Tissues that normally grow inside the uterus can develop outside the uterus and attached to the ovaries. Means the tissues which normally grow inside the uterus, that is develop outside the uterus and it attached to the ovaries. Outside the ovary is there and resulting in it form a kind of a cyst. So that is called as a endometriomas. Polycystic ovarian syndrome, PCOD. Commonly they will ask this question, explain about PCOD for 5 marks. This separately I will take, okay. This means in a many small cyst, plenty of small cyst over the ovary, either one ovary or both the ovaries are contained, okay. It requires treatment. If it is untreated, it may lead to infertility. The lady cannot have a child. She cannot able to get conceived. So it requires treatment only, okay. Okay, what may be the signs and symptoms if cysts are there means? Ovarian cysts do not cause any symptoms. Initially, if it is a size is very small means it won't cause, okay. Symptoms can appear as the cyst grows. It may be include abdominal pain, bloating or a swelling, painful bowel movement when like a passing motion and all. Pelvic pain will be there before or during the menstruation cycle, severe thus menstrual pain, painful intercourse during and after, pain in a lower back or a thighs, breast tenderness, nausea and vomiting, painful menstruation cycle every month, urinary problem, even due to that growth, no, it will maybe it will compress the neighboring structure. There will be urinary problem while passing urine, also pain or difficult to pass urine will be there. So in all these symptoms, of course, the lady has to approach the doctor. Severe symptoms of ovarian cyst that may require immediate medical attention include severe or a sharp pelvic pain will be there, that will be unbearable, fever, due to that sometimes dizziness, fainting will be there wherever it may be, while traveling or at home when you are alone or with a group or wherever. So it requires rapid breathing, means like excessive breathing count. So these symptoms can indicate a rupture cyst or a ovarian torsion means a twisting. So it required, otherwise it may lead to further complications. So to prevent that immediate, it required the action. So diagnosis, how to diagnosis? One is a history collection. When lady go and approach the doctor, when she say all that symptom is, the doctor get the doubt. So for the further, in order to know, physical examination, during when doctor do the abdominal examination with the hand palpating, the girl may react to that. She may get the pain. Ultrasound to know the how many cysts are there or which type of cyst. CT scan also sometime to know whether it's a cancerous growth or a non-cancerous. MRI in a depth imagination images of the internal organ. Treatment for an ovarian. Okay. So these all the diagnosis. Through all these things, when they come to know, yes, there is a ovarian cyst means management, medical management, surgical as well as a nursing management. See, medical management, when they come to know there is a cyst, if it is a small in size, it's not giving like a major symptoms. Wait and watch, because initially wait and watch, by itself it dissolve and go. In case if it is not dissolve and go, then the doctor will put a medication, that is a birth control pills, oral contraceptive to stop ovulation and prevent the development of new cyst. Oral contraceptive can also reduce risk of ovarian cancer. Analgesic, in case of severe pain is there, analgesic will be given. In case of nausea and vomiting, antiemetics will be given, and complete bed rest is required with taking more fluid. Okay, if through the medical management it cannot be resolved, means surgical management is required. That is one is a laparoscopy to remove the cyst. It is not given a cut open through abdomen. A laparoscopy means, you know, that left and a right side, through the, in the picture you can see that some tubes are making small hole, tubes are inserted, through that tube they will remove that cyst. It is not much painful also and not require long time hospitalization. Laparotomy, it is a surgery. Means a tummy means it is a opening, like you can see in a picture here, through the abdomen the cut is given and the cyst under GA incision is made, and the cyst is removed and cyst is sent for the histopathology to know whether it is a cancerous or a non-cancerous growth. Sometimes hysterectomy also required, means if doctors suspect it may be a cancerous, means while doing the surgery, complete the organs, uterus, everything will be removed. Okay, uterus, ovary, and sometimes fallopian tube, 3 organs are also, by discussing with the couple, doctor will remove if the doctor suspect it is a cancerous. Prevention, how come we can prevent? See, ovarian cyst cannot be prevented, but however, routine gynecological examination for early detection and treatment is helpful. That's why it is said after age of 35, at least once in a year, once in a 6 month is a good, but if it is not possible, once in a year, undergoing for the proper screening is the best to identify anything abnormality in an early stage. What are the nursing management? As a nurse, it is our responsibility. If it is a surgical case, posted for surgery means a post-operative management will be there. Otherwise, if it is just admitted means not surgery means pre-operative. It depends upon a condition, pre and a post-operative. That is assessment, history collection and a physical examination according to the symptoms, forming nursing diagnosis and implementing and evaluating will be there. Explaining about the condition, psychological support to the couples, lifestyle changes, especially exercise, yoga, meditation, stress-free life, and balancing the life. Everything is a very important. Explaining, then follow up whenever doctor said with a blood report, approaching the doctor. So all these are very important. So PCOD I will be taking separate. Okay, they may ask for the 5 mark. PCOD is a very important. Thank you, student. Hope you understood.